So next I would like to introduce Arvinda. So Arvinda is somebody who has grown up here, and then when she was 16, she had gone to villages in India, and ever since has been interested in helping out. For several years, we went back to work in the Narmada Valley and in Srikakulam district in Andhra Pradesh. And lately, we have been in the US. So Arvinda is also the development coordinator of AID, and she's been interacting very closely with the SATHI group, which Abhay Shukla, and others work. And Dr. Abhay Shukla had presented before in Maharasthra on healthcare. So Arvinda will give us the latest on what SATHI has been doing.
Yeah, thanks. It's very nice to be with all of you and take a moment to look at the impact of the work you have made possible during the last year, in particular with SATHI in Maharashtra, and also give you a preview of their plans going forward. I'd just like to step back a bit to the big picture of SATHI's goals. SATHI is been part of the movement, the right to health movement globally and at the India level, the People's Health Movement in India, and the Health for All Now, which was the Alma Ata Declaration of 1978. So it's part of a long-standing global movement whose counterpart in India, the Campaign for Universal Healthcare, has actually made some steps forward at both the national and state level. So here I'm just showing you the schemes at the national and state level that commit to free quality healthcare for all eligible families, which will be more than half the families. The majority of families in India will qualify for these schemes and have the right to healthcare. But how do you translate this to reality at the ground? This is what SATHI has been working on, for decades, and AID has been supporting different initiatives over the years. So this has gone on from before the pandemic, and in some ways, we can see that the work that they did during the pandemic actually provided added momentum, and I'll illustrate how that happened. So SATHI has always taken a holistic view of health. Health is not limited to health, but it also has to do with food and water and employment and transportation and everything, right? And so similarly, when the pandemic struck, they never took a kind of single virus approach to the pandemic. From the beginning, they knew that they would have to look at it in terms of access to healthcare. Maharashtra being the state that was worst affected, even by the single virus of COVID and everything that falls out from that. There were over both years, the total number of COVID deaths officially counted in Maharashtra was 1.4 lakhs. The case fatality rate was over 2%, and the total number hospitalized was 1.5 lakhs. And in the second wave of COVID, the majority, like 2/3 of the cases, were in the rural areas. So Kirti, can I have the next slide? One of the needs that SATHI identified at the very beginning was, you're advancing quickly. Anyway, well, just providing accurate information. First of all, we all know what the impact of rampant misinformation has been around the world, whether it is due to the disease itself or the vaccine or the medicine and all of these things, and the sense of chaos and insecurity and helplessness. To combat all of that, they prioritized gathering accurate information and disseminating it, and also having helplines. So, okay, go ahead, Kirti, the next slide. They started with the telephone helpline. This was last year. On top of it, they added help desks. Next slide. They placed help desks in 3 rural hospitals, with people who, and this is something they actually wanted to do since before the pandemic. Because access to healthcare was difficult for people without money and connections, long before the pandemic, and they wanted help desks in hospitals to just direct people where to go and make sure that they get treated with dignity, and they get access to the care they need, and they don't get overcharged. That's another that obviously you will not have access to healthcare if you cannot afford it, or you end up in debt. And that's also related to the medical debt is also compounds the crisis we heard Kiran speaking about, which is also the agricultural crisis. Before the pandemic, hospitals were hesitant to allow these help desks. I mean, they saw accountability and access, these people who are advocating for access and accountability, they saw them as some more of a headache than a help. Whereas when the pandemic hit, it just became obvious that, we cannot handle this ourselves. And so they actually welcomed these help desks in these hospitals. And last year they started with 3 in rural hospitals. Next slide, please. And they also had patient advocates who worked in the Pune urban areas. And they would just answer all questions that people might have. They were able to help many people be able to follow some sort of treatment at home. People who needed to come to the hospital. Next slide, please. They had a desk. Oh, okay. This is where Anyway, people who came to the hospital, they had a desk where they would, they just provide a certain sense of order and take away that sense of isolation and hopelessness that made access to care so difficult. And when the second wave struck, it was very clear that they needed to expand this. Instead of only three desks in the rural hospitals, it was expanded to 22. And this was done because they were able to do this right away because SATHI, like I said, has always been part of the People's Health Movement, and they have been connected with other movements in Maharashtra, whether they're working on right to water or land, farm workers, right to transportation, employment. All of these movements obviously were impacted by the pandemic, and so all of them came to take right to health training. All of them recognized that this was something where they could directly serve people in need, health being not only a primary need, but kind of connected to all other rights, which is, something SATHI has been saying for decades. So they had these trainings online and trained movements in other districts, other blocks in Maharashtra to understand right to health and be able to provide these help desks. Next slide. Next slide, please, people. So this is what the scene would look like in a hospital. Next slide. They would, each person would get a card. They would follow up on their cases. They assisted with vaccination. They went into the hospital and made patients aware of their rights. Now, another campaign point of SATHI and the People's Health Movement, Jan Arogya Abhiyan in general, has been not to overcharge. They have fought for rate regulation in hospitals. In the pandemic, the government granted rate regulation for COVID only. So starting with that, they gave people these rate charts so that they would know what so that they don't get fleeced by the hospital. Next, please. However, still some people were fleeced. So I was going to get to this. As a result of having networks in more than 20 districts in Maharashtra, this time when they wanted to collect data on people's experience with healthcare, this is another campaign that they have been doing since long before the pandemic, finding out people's experience with the healthcare system, when they have been denied care, what would have made things better, all this kind of information, whether it's just quick surveys or having interviews. In the past, it would take a long time to interview a critical mass of people and collect data and then advocate for it, hold public hearings, and try to bring this to the attention of authorities. This whole process took a long time. Still, some progress was made. But what happened in the pandemic, because the network grew and because everybody learned how to use Zoom and could have these meetings, very regularly, they were able to conduct a survey in 34 districts and find out about different aspects of people's experiences. But the one key experience that was reported, throughout was overcharging in private hospitals. Government hospitals often, didn't have adequate facilities or medicine or equipment or beds or whatever it was. I mean, they didn't overcharge, but sometimes you couldn't get care there. Private hospitals, it was found in this survey, among the respondents, 75% of the people were overcharged, and the average amount that they were overcharged was 1.5 lakh rupees. And these are people, who are daily wage workers. These are people who haven't worked because there's no virtual option. So this is devastating. And in some cases, it was much more. There were cases of even 20 lakh rupees overcharging of poor families. And in Maharashtra, actually, the government has recognized a category of individuals as COVID widows. It's not a phrase that I really like to use, but the Maharashtra government has recognized this category because not only did Maharashtra suffer the highest death toll, but they did find that it was, disproportionately impacting men of not even that elderly, many of them kind of middle-aged or even lower middle-aged. And so there were many women who were left, struggling to support a family with no income and no, no support of the husband, no income, and sometimes young children and debt. And on top of this, they were in debt. So I'm going to we're going to show you some of the statements of some of the women who spoke up. I'd see this is the other part. Even when you manage to collect data and stories of people, for someone to be brave to come forward and go public with their story, that also takes a lot of mobilizing moral support, which became possible this time around because of this critical mass of organizations that were involved at the grassroots. And the government had to accept that this overcharging was a serious problem. The Supreme Court took cognizance of it, and they actually said that people who had been overcharged could bring their bills and demand refunds from the private hospitals. Can we have the next slide, please? Oh, next. So once that was declared, then the movement put out notices asking people who were overcharged to contact them. They had tried this out in a few cases and succeeded. Next slide, please. People got refunds from the private hospital. It never happened. Sends a shockwave through the system that you cannot get away with overcharging people anymore. Again, the movements on the ground are very much galvanized because here you're seeing, you are seeing real money. You're seeing that we are able to help you address your grievance and get your money back, and to stand with dignity and say that you cannot just be taken for a ride at your most desperate moment. They can't just get away with just charging you anything. And so, I'm sorry, but this is, to give people vent for this kind of emotional release and sharing of their grief. The movement Jan Arogya Abhiyan, of which SATHI is a leading and central force, organized something called the Santap Sabha, or anger assembly, where people could vent their frustrations, see that they were not alone, and advocate for some redress of their grievance. And so now, Kirti, I would like to ask you just to show the first, I think 4 minutes of the video. I think will give people a good idea of this process. We were estimating with, if you take the average rate of overcharging and the total number of people who had sought care in private hospitals, if you extrapolate it to the whole number of people who were whose family members were hospitalized, it would actually come to 9,000 crores. Now, let's just take a lowball estimate and call it 1,000 crores. Then, that 1,000 crore rupees is like $125 million. If they had never been overcharged, all of this money would have been in the hands of the people. All right, let's see the beginning of this video. I'm afraid the audio is not coming. Well, while she's working that out, I just wanted to say that, so the next step is, how are these people going to get this money back? So that's one component of the next, the work that SATHI is doing, as we speak and going forward, is just providing technical assistance. People have to find the medical bills, find, different They don't always have bills, they don't always get receipts, but there's still possibly some way to follow up. So this kind of technical support so that people can document their cases and follow through is one component of what SATHI is doing. But the larger component going forward, as I said, this is kind of moving beyond the pandemic centric approach or the COVID centric approach and just go back to right to health as a whole. If people had not been overcharged, we're talking about at least $100 million, if not, much more, that would have just been in their pocket. Right now we're saying, okay, maybe, we're asking you to support, this many $1,000s to possibly help people get back this much money. But what if it hadn't happened in the first place? And what if it hadn't even happened, not only for COVID, but for anything? What if people simply received quality healthcare as a right? They would not have this insecurity. They would not have this stress that would in turn contribute to greater health. And, that is actually achievable. So the systems that the government has in place to make these health insurance schemes work and all of that stuff, now that with the energy of the people's movements that has come behind this issue of right to health, and with the government schemes, the Ayushman Bharat, the Health and Wellness Center, the Rogi Kalyan Samiti, all of these committees, to make them function. The next item on the agenda is to train a cadre of activists in the rural blocks and districts to make all these systems function, to make people aware of these committees, to make people aware of their rights, of the schemes, to interface with the government and make these function. And just as the help desk started last year in 3 districts, but then this year expanded to 22, 3 districts, and this year 10 districts, 22 blocks. Next year, the work in making the health system, the health and wellness centers, and the Ayushman Bharat schemes function. SATHI is beginning that work in 3 districts next year, but ideally plans to expand this throughout the state and throughout the country so that right to health is something that people believe in and achieve in every state and district, just as right to information started in Rajasthan and went national and now is just part of life, so will right to health. And that's the work that you have been supporting, and we seek your support to continue and grow it in the future.
Thank you so much, Aravinda, for telling us about the work that SATHI has been doing. Like Aravinda said, this work has been supported by Seattle chapter and continues to be supported. I think even last week, Seattle volunteers were voting to support this work. Now, I think since it's getting late, if we have any questions for any of the speakers, Kiran, Anil, and Aravinda are all here. Maybe we can take a couple of quick questions and then we can call it a day.
Yeah, no, I was just wondering, because that's, it's a little bit shocking, but not totally surprising to see that people who are already in such dire straits are being charged an extra 1.5 lakhs or whatever. I mean, that's maybe this is too big a question. Maybe we can take this offline, but this is the kind of stuff that you look at and you're like, first of all, how are people getting away with this? And then this is obviously a bigger thing than just in the time of COVID, right? This is obviously something that these guys do all the time, and they're gouging these poor families. What do you think can be done, I don't know, at a more systemic level to address something like this? Because this is the kind of stuff that's just like so wrong, just shouldn't happen.
I have a lot of hope in the plan that they, the action plan they're taking now. First of all, documenting all of these cases is what made the public take notice of this, much more so than they have before. I have been attending these kind of public hearings on denial of right to healthcare, for, I would say, 2 decades. But this time it came in all the press. The Supreme Court gave an order. I think finally they realized that, and somebody got a check back. That was huge. So just knowing that, you cannot get away with it, I think is what will change the behavior. Many I mean, there were so many, doctors and nurses that were working overtime, that were working without charging anything. It's not. It's. I don't think it's a fault of individuals like that. At least there are many who were working like that, I will say. But the system somehow created these avenues for corruption. If I could take a minute, I want to quote this one doctor, who was so excited by this campaign to stop overcharging. He wrote this long note to the Jan Arogya Abhiyan, and I'll just read a small excerpt. He says, "So long as the right to health is formulated in laws, it will remain a formal right whose real effect is somewhat unpredictable. It is only when the right itself is felt in the bones of the people as an answer to their experience of being wronged that a formal right will become a real right." So he was responding to the Santap Sabha, which video we tried to show you, that, this is what helps people feel that right in their bones. And I think that's when, I think it's a kind of chicken and egg, but in the positive sense, like when the rights are respected, people will stand up more for their rights and demand that respect.
Aravinda, just to continue the same question, Ankur had a question he's not able to pose, but how would you prevent hospitals from overcharging in future? Are they getting fined because of this when they found out? Do they know? Do you know they are being fined or?
I don't know if they're being fined. When they give the refund, I don't know if there's also a fine involved.
I think Saif had a question.
Yeah.
The Maharashtra government has said that they will audit the bills of all the private hospitals.
Mm.
Yeah. Right. Yeah. Yeah.
Kirti?
Yeah.
Kirti, just one.
Yes.
Now, I just wanted to add a point on that because we face the same kind of situations here also in Hyderabad. We were also running a helpline for COVID affected patients and their families and so on. And this whole thing, I think part of the reason why the government also doesn't step in is because there is a nexus, right? And some of the people who are running these hospitals, the big corporate hospitals, are directly connected with the political leadership. Not all of them. I'm saying that if, let's say, that 2 or 3 major hospitals are connected, then the government would not take any systemic step to control the prices and so on. So I think the public outrage becomes important. And earlier, I think the people would just think that, okay, this is part of the system, we cannot question it, and even if we question it, it is just a cry in the wilderness. Therefore, let's accept and move on, because obviously, even other than COVID, they would be facing this situation at a time of desperation. So they can't make an issue out of it and offend the hospital, right, or the health system, because they have to. That health system, that hospital has to save your family member's life. And then once you and they don't even discharge the patient before you pay the bill. And once you pay the bill, get the patient discharged. After that, you can just bang your head against the wall. Nothing much is going to happen. So it's basically this kind of a thing. It's essentially, making profit out of the desperate situation of the people. So I think that is why this COVID crisis bringing up this thing in a very stark way, then leading to public outrage, then enough people experienced it in a short time that it actually pushed the system to respond. I think that is that's what seems to have happened. But then the gains of this need to be carried on to the post-COVID period, and that is where I think that this should move to a push towards a better regulation, and also the public. Like some forums for the public to bring out these kind of overcharging situation, like the Santap Sabhas kind of a thing, but maybe in a different form. Continue to happen like every 3 months or every 2 months, so that people know that they have a forum where they can go and present their cases, and then there is a public shaming of the hospitals which are doing it. So that, along with the government's regulation, I think all of that needs to go together.
Yeah, of course, Kiran, thank you so much for that. It's always inspiring to listen to all of you.